Hello, Dr. James Bogash, publisher of Modern Health Myths. Today's COVID uh, video is going to be a little bit dicey to say the least, and certainly going to be controversial. Again, I am just pointing out the data. I'll give a couple ideas on this, but it has to do with what's called a nosocomial infection or a hospital-acquired infection. I have always stated that hospitals are a dangerous place to be. There are bugs running around in hospitals that you generally wouldn't get out in the community. Things like probably the biggest one is C-diff. There's certain forms of E. coli that you generally get, and MRSA, can't forget MRSA, that are acquired in a hospital setting and not usually in the community. This, but we haven't really looked at this question with COVID. So in other words, what is the likelihood that somebody goes into the hospital for whatever reason? Let's say they've got the sniffles or they've got a fever and they're scared and they run down to the ER and they get admitted for whatever reason, and they didn't go in with COVID, but they left with COVID. That is the idea of a nosocomial infection. This in no way, shape, or form is condemning anybody. There are certainly more than enough challenges with obtaining proper PPE. And early in the game of COVID, everybody was rushing to kind of accommodate and certainly wasn't as important. But even today, the healthcare workers don't have the resources that they need to protect themselves. And we think about that for the healthcare workers themselves, but then we don't think about how much those healthcare workers spread that to other patients. So with that in mind, this particular study looked at both COVID, MERS, and SARS. And the numbers they determined for COVID was that in these particular studies in these regions, that 44% of the diagnosed cases were actually nosocomial. They were actually acquired in the hospital. So, wow, does that open up a can of worms? And it just reinforces the idea that hospitals are a dangerous place to be. And how many of these patients, we're in a society right now that everybody is running to get tested. Some of the people go to the ER, some of those people get admitted for whatever reason, but we are seeing people going to the doctor or the hospital for things they probably would have otherwise just let go. If you had a cough or a sneeze a year ago, you wouldn't have thought twice about it. You would have just worked your way through. Now we want to know if it's COVID, and we want to run and have that Q-tip shoved in the back of our skull and see if we are positive for COVID or not. So this particular study, looking at 44% of the cases in the region that this was, it looked at multiple studies, but ultimately the COVID, which was only a handful of studies, was 44%. In MERS, this was as high as 56% of the cases were actually acquired in the hospital. Just have to point this out that, and when I say in the hospital, we're talking about the doctors, the nurses, and the staff. So that can be transporters, that can be techs, whoever it may be that's interacting with the patient. I do have to point out that one of these studies, in 53% of the infected healthcare people that wore masks, 47% of them were cloth masks, and they still spread this virus around. So just wanted to throw that out there. What this really boils down to is, A, we really shouldn't be going to the hospital unless we really need to go to the hospital. Even the ER, if it's just out of a curiosity factor of getting checked to see if you have COVID, maybe it's fear of what might end up happening. It may be that your fear that you might have COVID ends up creating the scenario where you actually do get COVID, where you wouldn't have had it beforehand. This just, again, reinforces the fact that our healthcare workers need to have the proper protective equipment, and the more we steal this in the community, the less opportunity they have to have properly fitted equipment. This includes gloves, it includes shoe covers, it includes gowns, it includes eyewear, it includes masks, all of it. These people need to have that. It also means that if you are going to the emergency room, whether you have COVID or not, you should be wearing protective gear because it is a dangerous place to be. This is a virus that's running around the healthcare system, and at this point, you need to protect yourself. And that certainly would make sense when you are in a scenario where the likelihood of being exposed to COVID at this time is probably much higher than it would be at the grocery store. So as always, I will post a link to this particular study in the comments section, and feel free to like this video, share it with somebody who you think will benefit from the message, and subscribe to the channel.